And we are live. And we are live back with Ryan Gumpper. Hi, how are you?
Good. How are you?
Good. Thanks for stopping by.
Yeah. Really appreciate you having me here.
I saw some of your talk this morning. Could you briefly summarize it for us?
Yeah, sure. So my talk was surrounding the polypharmacology of many psychedelic compounds. So in short, it was a summary of a paper that was published earlier this year in Neuron, where me and my co-first authors in Brian Roth's lab, we did a full characterization against a library of 41 different psychedelic compounds, profiled them against 300 plus G protein coupled receptors, and then really investigated all of the various signaling pathways that they activate from that. So it's a really cool resource that was available for us to do.
I heard someone on a podcast saying, I forgot his name, but he started a psychedelic company saying the dirtier, the stronger psychedelic. Do you think that's accurate?
So all psychedelics have like a robust polypharmacology. So most of them will hit all of the serotonin receptors. Here and there, they'll also hit dopamine receptors. And we also found they will also activate adrenergic receptors. So I don't know if you could say that the more stronger the drug is, that the more polypharmacology is there. And I guess strength is kind of a weird thing to use there. But I would definitely say that all of them have a robust polypharmacology. They're very dirty drugs in general. They don't just target one single receptor.
And is polypharmacology correlated with the length, the duration?
No. I guess kind of some known studies on that would probably be, some various PK studies, how long the drug is around. Also, it's been shown for a lot of ergolines and LSD-like compounds, there's actually a lid that comes over the top of the serotonin 2A receptor. So it just never really wants to come off the receptor, and that could explain some of the length of the trips for specifically for something like LSD.
And what brings you to that conference? Why do you like this conference in particular?
Yeah, I love this conference because it's a really good conglomeration of people from industry, academia, and like all walks of life in the psychedelic industry. So I really like coming to this conference. I came to this conference a couple of years ago when it was in San Francisco. And that was the first time that I actually gave a talk at it. But overall, it's a really nice mix. I always meet a ton of new, cool individuals within the whole, psychedelic field.
And do you have any takeaways overarching? I know it's only the first day, but do you have any takeaways from this conference? I don't know, but from the talks or discussions in the hallway?
Yeah, it seems like there's a lot of excitement around potential approval by the FDA, especially around Compass's new drugs that are coming out. Also, there's been more and more talk, I'm noticing, around non-hallucinogenic serotonin 2A agonists or non-hallucinogenic psychedelics. So those are all kind of more exciting places to be.
And just to close on the 5-HT2A, how do you see the non-hallucinogenic window? There are many theories floating around. Which one do you think is the most accurate today?
So from what's responsible for therapeutic effects? Or what's responsible for hallucinations?
Both, but yeah. Let's try with hallucination.
Sure. So I think it's very clear in the literature that serotonin 2A agonism is responsible for psychedelic-mediated hallucinations. Also, probably likely the therapeutic effects as well. There's a lot of data pointing towards that, but I also think polypharmacology is going to play a big role here when it comes to therapeutic effects as well. We see, going back and 50, 60, 70 years now with various antipsychotics that have been developed. These are all very dirty drugs as well. And they've developed very specific antipsychotics, and they tend to fail in clinical trials for things like schizophrenia. So I think polypharmacology may be a way forward, that where serotonin 2A is necessary, but also some of these other receptors that you could potentially agonize are important for other therapeutic effects that we might see.
Right. Thank you very much, Ryan, for stopping by.
Yeah, thanks for having me.
Yes, enjoy the rest of the conference.
Thank you.
Thank you. Thank you. I appreciate it.